Welcome to today's birth prep mobility flow where the entire sequence is in standing. So if you are someone who experiences knee pain or just has a hard time getting down on the ground at this point in pregnancy, this birth prep mobility flow is for you. You really don't need any equipment other than maybe a mat. I do have a Pilates ball nearby that is optional for one of the movements, but not required whatsoever. We will start by improving mobility kind of in our upper back and side body rib cage, and then work our way down to the pelvis by improving and creating space in the top part of the pelvis all the way through the bottom, and finish off with some diaphragmatic breathing. But let's go ahead and get started with an inversion. So this is technically one of the only movements that isn't necessarily in standing, but you're still not on your knees. So you're gonna perform a downward dog. So you're gonna start in a standing position, and I'm just gonna have you reach down towards the mat, walk your hands out, and keep your hips lifted high, just as far as you can go. And we're just performing this for 3 breaths here. Inhale through your nose, exhale, let it go. Inhale, exhale. One more, inhale, and exhale. Carefully make your way back up into standing. If you are someone who experiences hypertension or high blood pressure, you can always omit that movement in the future and just perform diaphragmatic breathing in standing. But I like to perform some sort of inversion to help release lower uterine ligament tension before we go ahead and get started. Alrighty, first movement for upper back mobility. Get into a split stance position, right leg is in front, soft bend through the knee, hands out in front of you. Windmill the right arm towards the front leg and around. We're doing each movement for about 45 seconds with a 15-second rest. Really just using that rest to get into the next movement. We're creating space through the chest and the upper back and rib cage area. A lot of people skip the upper back and the ribs when they do birth prep mobility. They think only the pelvis and the hips matter. And yes, of course, the pelvis and the hips matter, but so does your upper back and your rib cage region to create space for baby to move, especially if your baby's kicking you in your ribs. The more space, the better. Let's go ahead and switch sides in 4, 3, 2, and 1. Left leg is forward, soft bend in the knee, hands out in front, windmill the left arm towards the front bent knee. Windmills are one of my favorite movements for the upper back. Normally, I love to perform them on the ground, but today's goal is to keep you in standing the entire time. Reach that arm long, keep it in line with your shoulder. Throughout this entire flow, I just want you to focus on taking big inhales and exhales. You're not contracting your core at all. You're just finding space through the ribs and side body. We'll have a sumo squat to side body reach in 4, 3, 2, and 1. Start with your feet out wider than hip width apart, toes pointed out. What this looks like is let's start with the right hand. So you're going to inhale, squat down, exhale, reach up and over to the left. So we're pairing a wide sumo squat with a reach up and over. So we're getting some good side body release, but we're also getting some pelvic outlet opening and pelvic inlet opening with a deep squat. If you hate the squat, you can omit it and just perform the side body reach, or maybe you just don't go down as deep. Maybe you just perform a little mini squat if that feels better for you. But getting the hips lower than the knees is going to help open the pelvic outlet the best. So trying to get as low as possible is going to feel the best for you. You might feel some pressure depending on how far along you are in pregnancy. Let's switch sides in 3, 2, and 1. I'm currently 37 weeks filming this. I'll be 38 tomorrow, so I feel the pressure when I get down into that sumo squat. And that's normal. That's okay. That just means you're creating space in that pelvis for baby to get nice and low. You can also choose to inhale as you reach up and over and exhale on the way down. It all just depends on what feels good for you. As long as you're not holding your breath, I'm okay with it. We have a standing pelvic tilt after this to help open the top part of your pelvis. Whew. Quads are feeling it a little bit. In 4, 3, 2, finish out your rep, and 1. Standing pelvic tilt. Meet me in a tall standing position. Feet are hip width apart, soft bend in the knees. Sit back in your glutes a little bit, hands on your hips. Exhale, gently tuck your pelvis underneath of you. Inhale, reverse the movement, spread the sits bones, and think about dumping your pelvis forward. Exhale, tuck. Inhale, dump. Now, this will be the one time where it's okay to use your core right now during these mobility flows to help pull the pelvis underneath of you, because I don't want you to squeeze your glutes or your butt cheeks. Trying to keep them nice and loose, and just use the deep core to help pull that pelvis underneath of you. We've got a stationary lateral lunge reach coming up in 5, 4, 3, 2, and 1. Back to that wide stance position, even wider than that sumo squat. Feet are pointing forward this time. Let's start by going to the left. So inhale, lunge to the left, reach forward with the right arm. Exhale, come to stand. We're just going to the left for 45 seconds, and then we'll switch. Sitting back into that left glute, keeping the weight evenly distributed through your feet, pressing through the toes as you come to stand. Opening up the mid pelvis through asymmetrical movement. If you have pubic bone pain, go ahead and narrow your stance and just perform a smaller hip shift to that left. But the wider you can go, the better. Let's go ahead and switch sides in 4, 3, 2, and 1. Lunging to that right. So if you have heard of people curb walking at the end of pregnancy to try and induce labor, this is kind of where this idea comes from, this lateral movement. It creates asymmetrical activity through the mid part of your pelvis. And that's oftentimes a place where baby will get stuck during labor, or baby has a hard time passing through. And so if you can create more space through the mid pelvis, it can help engage baby and hopefully get labor going. But like I said, none of these movements are necessarily designed to induce labor. They're just to encourage an increase of space. If they do happen to induce labor at the end of your pregnancy, that's amazing, but you can perform this in the first and second trimester as well. We got a deep squat circuit in 4, 3, 2, and 1. For this deep squat circuit, you're going to get low as you can. Hands on the insides of your knees. From here, you're pushing both knees out, then just the left, and then just the right. Both knees out, just the left, and just the right. If you need to, you can just sit on a stack of yoga blocks or books if you can't get all the way down like this. Also, if you can't get down like this, you can choose just a little mid-range squat here and still press your legs out with your hands on the inside of those knees. So you're still getting a little bit of asymmetrical movement, but the deep squat is going to help to really open that pelvic outlet the best. Standing hinge in 4, 3, 2, and 1. For this movement, this is where you can grab your Pilates ball if you want. Standing tall, place that ball between your inner thighs. The purpose of the ball is to help increase inner thigh engagement, which is going to help to improve hip internal rotation, which helps to open the pelvic outlet. So from here, even weight through your feet, gently squeeze the ball. Inhale, sit back in your glutes, soft bend through the knees. Exhale, come into a tall standing position. You're imagining you're looking over an imaginary cliff as you sit your booty back towards the wall behind you, keeping the ribs stacked over the pelvis. Soft squeeze through the ball. So you're still keeping your weight through the middle part of your feet. You're not allowing the toes to pop up. And you're pressing your feet through the floor as you come to stand. For 5, 4, 3, 2, and 1. Our final exercise, promised you we would finish off with some diaphragmatic breathing. We're going to perform this in a standing position. And sometimes it feels best to hold onto a wall or something. You're just going to sit back into that hinge position again. You option to place the Pilates ball back between your knees to help get more inner thigh engagement. And then you're inhaling into your anal sphincter. Exhale, let it go. Inhale, expand. Exhale, let it go. Now, if you have a wall near you or something you can actually put in front of you, that might be best. That way you can really sit back and then you can breathe into that pelvic floor. So this isn't a deep squat, it's more of like a sit back into your glutes. Like that hinge movement. Squeeze that ball and really feel on an inhale those sits bones spread and lengthen. For 4, 3, 2, and 1. I hope you enjoyed today's standing only birth prep mobility flow. If you have any questions about some of the movements or pregnancy in general, please drop a comment below, and I would love for you to like and subscribe to this channel, especially if you want to continue seeing more videos like this. And if you love today's birth prep mobility flow, you will love my birth prep program. I will leave a link in the description below.